Welcome to Study Time, a televised home learning program produced by Rwanda Basic Education Board.
Hello, dear students. A very warm welcome to the TV learning programs. As usual, I'm teacher Herbert, and I will be with senior 2 or form 3 biology class. We are still on unit 16, reducing risks of STIs and HIV and AIDS. HIV and AIDS. We are going to have lesson 2. Lesson 2 is concerning about the transmission of HIV and AIDS, treatment of STI and HIV AIDS. We're going to see how we can treat under the HIV and AIDS and the treatment. Okay? So before we start our lesson, it's not your first time to hear the word STI, sexual transmitted infections. And again, it is not your first time to hear the word HIV and AIDS, human immune virus, AIDS, acquired immune deficiency and syndrome. Okay? So we're going to see the unit is concerning the risks of reducing STI and HIV AIDS. All these STI, they are sexual transmitted infection. They are transmitted through sexual intercourse. So let me just start the lesson by showing you the diagram. You see what you see in the diagram, student. See the diagram, and you guys just try to see what is happening. You see there is a pregnant woman. There is a doctor or a medical practitioner. He's trying to show him, maybe if you find the woman we are reducing the risk of HIV and AIDS. You may find that woman is HIV positive, but she's pregnant. She has the right of her pregnancy, and she needs to be having more attention. Okay? We have another diagram. You see people, they are sitting on a chair. There is a room. You see in that room there is what you call VCT. Student, when I talk about VCT, it is not your first time to hear the word VCT. Voluntary counseling and testing. They are going for testing of what? They are going for testing of HIV and AIDS. They are going there for testing of STIs, sexual transmitted infections. Because we have seen how these diseases are more serious and how they are more dangerous to our health. So we have to take care of them, doing what you call VCT, voluntary counseling and testing. Okay? Because if you are able to be counseled, if you are able to be tested and you know your status, your health status, it will help you to know how to go about it. Okay? You may think that when you are affected with HIV/AIDS, you are a dead, moving person, or you associate the disease with the death. And which is not true. As long as you have discipline, you can stay wrong and you become more productive. All right? Let's go through the lesson. I talked about the lesson, but we can also try to see what does the intention, the lesson is intending to do what? What is the knowledge we have to get from here from the lesson? After studying this lesson, students should be able to explain the transmission of HIV, that is human immune deficiency virus, because it attacks the immune system. Human immune deficiency virus infection, and we also be able to describe the treatment of STI and HIV/AIDS is based on their causative agents. So that is the two main learning objectives we have to attain at the end of the lesson. Okay? So let's start the lesson, and the transmission of HIV/AIDS. See that? Okay? We talked about HIV/AIDS. In Africa, most people, a big percentage of people are affected by HIV/AIDS. We have talked about the rights of people living with HIV/AIDS. Okay? And how can we support people living with HIV and AIDS? The transmission of HIV/AIDS, human immune deficiency virus infection. So HIV is a virus that causes AIDS. The virus that causes AIDS is referred as HIV/AIDS. That's why I said AIDS is a disease caused by the virus, by human virus. So when you talk about in full HIV/AIDS, it is acquired immune deficiency syndrome. All right? It is mainly transmitted through where do we get the disease? How can disease can be transmitted from one person to another person? It means that the disease can be transmitted from an affected person, to a healthy person. Okay? So certain body fluid, most of the time we talk about body fluid. Body fluid. Talk about body fluid. That one involves the blood, the semen, the pre-seminal fluid, erectile fluid, vaginal fluid, and even breast milk from the person who has HIV/AIDS. So even a baby can get contaminated or can get affected by feeding on a breast milk who is from a mother who is HIV positive. All right? So these fluids must come in contact with the mucous membrane or damaged tissues or be directly injected into the bloodstream. That is from the needle or what you call syringe. All right? For the transmission to occur, the mucous membrane are found inside the rectum or vagina or penis, and mouth can be in contact. When they become in contact, likely to be affected by HIV/AIDS. All right? I think a point taken. You have taken a point. All right? So, having an anal or vaginal sex with someone who has HIV/AIDS, who has HIV, without using a condom or taking a medicine to prevent or to treat HIV, or have what you call anal sex. Student, I hope you still remember what you call sexual behaviors and sexual responses. Talked about sexuality. Okay? We talked about sexual education. Sexual education is this education that involves to make you aware about these sexual transmitted infections. So anal sex, that is the sex done in anus. We talked about the lining of the anus is more delicate. People, they can do what you call, they can do sex in the anus or anal sex. They may think that they are not affected. What it can prevent anal sex is just not getting pregnant. But transmission of HIV/AIDS is very high because we talked about the lining of the anus is more smooth, so damages can happen very easily. So we also talk about anal sex is the highest risk of sexual behaviors. All right? Vaginal sex is also the second highest risk of sexual behaviors. All right? You categorize them. We have anal sex, we have oral sex, we have vaginal sex, okay, which is the second highest risk of sexual behaviors. Sharing needles or syringes or other equipment or used to prepare drugs for injection with someone who has HIV/AIDS can also give a chance for a person to have HIV/AIDS. That is sharing sharp objects. When you talk about sharp objects, everyone knows what are sharp objects. Needles, syringes, and etc., razor blades, and etc. This could be having a certain percentage of a person to get affected with HIV/AIDS. Sharing syringes such as this could lead to the transmission of the disease. All right? Let's talk about, less commonly, HIV/AIDS may be spread through, what do you think the diagram is trying to show you? What is the implication of the diagram on your common understanding? All right. So mother to child during pregnancy, or birth or breastfeeding, although the risk can be high if the mother is living with HIV, if the mother is HIV positive and not taking medicine. You see the diagram? When you go through the diagram, you are able to understand. What does the diagram show? It is showing how the mother can transmit the disease. How can it transmit the infection to her born baby? Okay? So if you try to go through, okay? So let's go the diagram. So I was trying to make sure that the mother can also affect the baby during childbirth when the mother is HIV positive, or during breastfeeding. Being stuck with an HIV-contaminated needle or other sharp objects, all right? Other sharp objects. This is a risk mainly for health care workers. Okay? In some rare cases, HIV has been transmitted through. It can also be transmitted through receiving a blood transfusion. We talk about through blood transfusion. So blood products or organ or tissues or transplants that are contaminated with HIV/AIDS, that one can also bring a risk of a person to suffer from HIV/AIDS. Okay? You're getting me very well. You're getting the content as I'm mentioning it. Okay? Eating food that has been pre-chewed by HIV-infected person. You may think that maybe the food has been chewed. I mentioned there in another previous lesson, talking about how is HIV/AIDS can be affected by a person having what you call sore throats, and the mouse can also transmit the disease. Okay? So eating the food that has been chewed, that has been pre-chewed by an HIV-infected person. The only known cases are among infants, most of the times among infants. Being bitten by a person with HIV positive, there is no risk of transmission if the skin is not broken. If there's no blood contact, that one cannot transmit the disease. Okay? So, contact between a broken skin, let me take an example. You can have an accident. When you have an accident, people can get damaged, people can get injured, and eventually when they get damaged or injured, the blood can come in contact. When it comes in contact, what happens? Of course, they will what you call exchange of what you call mucous membrane and even HIV-infected blood or blood contaminated by body fluids. Eventually, you can also suffer from HIV/AIDS. Okay? Are we together? Good, if you are on the same line. I hope we're on the same page. Deep or open mouth kissing, if both partners have a sores or bleeding gums. Kissing can also be one way of transmitting the disease. HIV is not spread through saliva, but oral sex can also transmit the infection. Okay? Let's try to look on the treatment and care and even care based on their causative agents. We're going to see on the treatment, care, and even their causative agents. All right? So treatment of STIs and HIV/AIDS is based on their causative agents. Because when you talk about the bacterial STIs can be chewed using antibiotics. I talked about a very number of diseases caused by bacteria, which are STIs. I talked about chlamydia, or sometimes we talk about candidiasis, we talk about syphilis, we talk about gonorrhea. It is those diseases can be treated by using antibiotics. all right, if the treatment begins earlier enough. But if the treatment does not begin earlier enough, it will be hard to treat, because the earlier the better. The earlier the better, all right? Antibiotics often, in a single dose, can cure many sexually transmitted bacteria or parasitic infections. These including gonorrhea, syphilis, chlamydia, trichomoniasis, and etc. and etc. Okay? Which is contrary to HIV/AIDS, because HIV/AIDS is not a disease caused by bacteria. It is caused by a virus, which you call human immune virus, human immune deficiency virus. Okay? So, the treatment of gonorrhea and chlamydia is always done at the same time, because the two infections often appears together, all right? That is, can just be treated at once. But viral STIs cannot be cured, cannot be cured. Is that word correct? The viral STIs cannot be cured. The question is, but the symptoms can be managed with what you call medications. There's what I've been talking about, what you call antiviral therapy. These therapies that we do people having HIV/AIDS do take. For instance, there is what you call a vaccine against hepatitis B, but it will not help if you already have the disease. If you already have the disease, it will not help anymore. Okay? So that is to talk about HIV cannot be cured, but can be managed. Talk about in terms of management, how can you manage it? There's no way how you can cure the disease. As the other STIs, how they are being treated. Take an example using antibiotics, all right? But here on that side, we don't use the antibiotics. We have, and there's no treatment and cure, but it has to be managed. Talk about self-discipline. Talk about self-discipline, everybody has to understand what I'm talking about. All right? So a person may choose to visit a voluntary counseling and testing, and you're able to understand your health status. Okay? What you call VCT. We have seen in the diagram, seeing people lining up in hospital, visiting the VCT centers. You remember we talked about very many organizations. We talked about AIDS Health Care Foundation, AHF. We talked about ENACOS. All these organizations, they are helping to reduce the risks of HIV/AIDS. ENACOS, if you remember, it is a word in French, initiative, there's combattre des sida, something like that. We talked about AHF, which is AIDS Health Care Foundation. And what does this do? They carry what you call VCT, voluntary counseling and testing. Centers to undergo HIV and AIDS counseling, all right. After that one comes in terms of management. If you're able to manage it, if you're able to detect the disease earlier, and you go through a self-discipline, all right? So after counseling, he or she can make an informed decision about whether to be tested for HIV or not. Take a decision of either to be tested for HIV or not. And that is your right decision. That is the diagram. Okay? Children, old people, young people has to be tested. People waiting to enter university room or university center. Okay? If you have not gone for testing, my friend, and this could not be done, maybe it could not be done at once, it is something that needs to be done regularly. Talk about regularly, that is several times. Every month you can go there for checkup. So you go and visit this VCT, you try to see your health status, all right? So at VCT centers, the pre-test and even post-test counseling is offered to assist people to learn more about their status. Precisely, I'm talking about their health status. So counseling involving getting information and learning how to live positively with the virus. People, they decide to live negatively with the virus, but that is not correct. You need to live positively with the virus. So this means learning to accept the fact that one is HIV positive, is HIV infected, seeking the emotional support, eating a healthy diet, learning how to control the amount of stress in your life, making sure that there is no reinfection, and planning for the future. If you are planning for the future, you become more productive. Okay? It's clear, I think. So, if you are able, you become more productive, you are planning for the future. That is living positive with the disease. Antiretroviral therapy, ART, which is ALT, antiretroviral therapy, is the use of HIV medicine to treat HIV infection. People on ALT, or antiretroviral therapy, takes a combination of HIV and AIDS drugs every day. It is not take it every day, all right? People infected with HIV and AIDS should start ALT, antiretroviral therapy, as soon as possible. ALT, or antiretroviral therapy, can cure the HIV/AIDS, but it helps. It can't cure the HIV/AIDS, but helps people infected to live longer, and healthy lives. So ALT, or antiretroviral therapy, also reduces the risk of HIV and AIDS transmission. So you are getting what you call how to reduce the risks of HIV/AIDS. Okay? Let's talk about the potential risk of ALT. Includes unwanted side effects from HIV and AIDS, drug interactions. This includes not taking the drugs every day as required, as it is required. You're not taking the drugs every day as it is required. It could lead to drug resistance and treatment failure. You get the point? Are you following me? So this is how the HIV/AIDS should be treated and should be cared. Student, we've seen how AIDS is very dangerous, how we should try to be more, how to live more positive with HIV/AIDS, okay? How we should try to go for VCT, voluntary counseling and testing centers. We should, when you know that you are HIV positive, we've seen how you should take ALT, antiretroviral therapy, which could just reduce the risks of HIV positive and makes you to become more productive, and you're also planning for the future, which is very clear. Now, we've seen how HIV/AIDS is spread. You can mention a number of them, how HIV/AIDS is spread. We said number one, it can be spread through sexual intercourse. Sexual intercourse. When you talk about sexual intercourse, that is doing unprotected sex. That is very clear. Second, it can also be spread through what you call this fluid being in contamination of the fluid. That is blood in contact. When the fluid membrane are in contact, you can easily be affected. That is through blood transfusion, through maybe accidents, and it is we talked about even through anal sex and even oral sex and even vaginal sex, sexual intercourse. We also talked about it can also be transmitted through mother-to-child transmission, through breastfeeding, or through during childbirth, through birth canal. When there's something that can happen also blood transfusion, we mentioned a number of them. And we also talked about if you try to take If you go for testing and you find you're HIV positive, you are advised to take this antiretroviral therapy, ALT, which is used for HIV medicine to treat HIV infections. So people on ALT can take a combination of HIV and AIDS drugs every day. You have to take them every day, all right? And you avoid stress. If you avoid stress, you try to take the drugs as it is prescribed by the doctor, as well as, okay, you take a balanced diet. Okay? A balanced diet. So students, I'm coming to the end of the lesson. Do you think the right method of avoiding HIV/AIDS? We mentioned one, abstinence. Because abstinence, it is like throwing one stone and killing two birds at once. You prevent yourself from STIs, that is sexually transmitted infections, and even HIV/AIDS. Not only that, it also prevents you from having unplanned pregnancy or having unplanned pregnancies or unintended pregnancies. That one, abstinence is the best. It remains to be the best method. In my conclusion, I'm concluding by telling you that abstinence is the best method. If you cannot abstain, adopt other methods like using condoms, both femdom, and even the male condoms as well. Okay? To avoid all those sexual transmitted infections. To become a people who has future. Okay? That is what I'm trying to ending up and concluding. So before I end my lesson, so I want to leave you with a lesson assessment, which has almost like 3 numbers. What happens in VCT centers? What do you understand by the term ALT, which is the surest and the best method of preventing contracting of STIs, using condom properly, having faithful partners, visiting VCT, and abstinence. Students, thank you very much for your active participation and listening.